You must be wondering what is going on with CRNA live CRNA practice, especially during the coronavirus. We are currently in April 2020, and it's the beginning of April, and of course it's April 8th when I'm filming this video, and you must be wondering what's going on with salary. Will you still have a job as a CRNA? Well, in this video we're going to talk all about it, so definitely keep watching. My name is Christine, and welcome to a new video. It's your first time here and you want to become a CRNA or grow your CRNA career. Start now by subscribing, hitting the bell so you don't miss a thing. Hey guys, I hope everyone's well and safe and, staying home and keeping healthy and keeping positive. I know this is a time especially that's a lot of change going on, especially with our environment, the healthcare environment, as well as social environment. So it's definitely a hard time for us, but I'm so happy that I'm here on YouTube digitally to be here for you, and as well as motivate you to still continue your dreams to become a CRNA. And especially now is definitely a turning point with healthcare, positives and negatives, but I think it's really going to push a new front line of healthcare management, ventilation management, airway management, as well as research in regards to all these unique viruses that have been happening throughout the years. But of course, this COVID virus is definitely a unique one. And you can check out the CDC website to know more information about that. But I'm here just to focus on CRNA live CRNA practice. So yes, it's been a very difficult time. In general, there's a lot of changes that have been going on, where a lot of social distancing. Now I know that there's a lot of recommendations from the president as well as a lot of world leaders that when you are out socially to wear a mask to protect yourself. I agree. I think it is a great way to do it, but I feel also social distancing yourself and staying home is the most best way to prevent yourself from getting sick, as well as hand washing. I feel hand washing your hands the old-fashioned way for 20 seconds or more with soap and water, as well as, of course, using hand sanitizers. But I always believe the old-fashioned way is to wash your hands with soap and water for more than 20 seconds. But just to get into more focusing on salary, there's a lot of changes that have been going on. Now, as a CRNA currently, at my facility, hours have been cut almost about in half. Now, it depends on the facility you're working at. When you think about salary, a W-2 employee versus independent contractors, we are seeing a lot of changes in the healthcare field. So a lot of people who are travelers, who are independent contractors, meaning you're 1099, per diem, part-time, a lot of those individuals are not getting hours. They're not even, a lot of contracts with travel agencies have been canceled. Now, of course, it depends on the area you're located, but some areas in the country, like New York City, New York in general, or maybe on the West Coast, like in California and Washington, there's a high demand in the hospital facilities. So therefore, of course, if there's a lot of emergencies, a lot of cases, they need all the extra help that they can have. But when you think about more smaller hospitals or hospitals that are certain areas that are not being affected greatly yet, there's a lot of recommendations depending on the state you're living in that they want to cut basically elective cases and just focus on emergent or emergency cases or urgent cases in the sense that these cases need to go because someone will not survive in the next 2 weeks, for example. I'm giving a pure example. So yes, in that case, if you're not having elective cases, therefore you're not going to need as many anesthesia providers. Not even anesthesia providers, you may not need as many nurses in the operating room, as well as surgical techs, auxiliary staff, and more. So definitely I've been seeing that, it's not as many cases going on in my hospital and hours have been cut. Now, on the bright side, I feel it's important to think of everything in a positive note. This is a time that a lot of anesthesia providers, now, even though, yes, depending on the hospital you're working at, this definitely varies from state to state, region, as well as hospital, because every hospital is different and what they're doing is different. But looking at it on my viewpoint of being a current CRNA, I am seeing more of, like I said, emergent cases, urgent cases, as well as now there's a transitioning point, depending on the facility you're going to be working at, that a lot of CRNAs or anesthesia providers, anesthesiologists, they're starting to use them in the ICU. Now, when you think about, what do you mean, am I going to become an ICU nurse? I mean, looking at the ANA website and also looking at our malpractice insurance, as a CRNA, you are a registered nurse. And yes, your focus is in anesthesia, but gotta remind yourself, you are ICU trained, so you have that as a backup in general, which is great as a CRNA. But so there are some cases, depending on the facility, that some CRNAs are helping out in the ICU. Now, I'm not saying that they're doing cases, for example, taking two patients, for example, and doing ICU nursing. So, like I was getting back into, is that some facilities, depending on, now the operating room is not busy, so we have all these extra anesthesia providers. Now, you got to remind yourself, as an anesthesia provider, a nurse anesthetist, you are airway management skill set, you are hemodynamic management skill set, you're an expert in ventilation monitoring, airway management, hemodynamic monitoring, especially we do cases, we take care of patients, we do a lot of vent changes and titrations, intubation, extubations. I mean, it just goes on and on. We can do IV access, we could put arterial lines, central lines, we can do codes. So then some facilities, depending on where you're working, they are using CRNAs in that route. So because you got to remember, a lot of these ICU intensivists or ER doctors, as well as residents in the ICU and intensivists, are overwhelmed with patients. I know a lot of COVID patients, there's a lot more COVID patients, critically ill patients, is a lot of patients being taken care of in the facility. So think about the staffing ratio now, it's overwhelming. So therefore, as CRNAs, we can actually help. Think about this too. Yes, I know we're scared. You scared, oh my gosh, there's this virus that's going on. I don't want to get it. I want to take it home with my family. But for me, being a CRNA and being an anesthetist, as well as being in the healthcare field, I know that I am here to help and I am here to give back to my community. And I went into nursing. I went into the healthcare environment knowing that, yes, of course, there's always a lot of risk, but at the end of the day, I'm here to help people. And that's why I feel that I need to be there. And if there's any way as a CRNA that I can help, I'm more than willing to, because even as an ICU nurse, yes, it may not be the COVID virus, but there's a lot of different viruses that you can be exposed to, as well as bacteria. I mean, you may know this. If you have patients who are septic, for example, now they have some type of a systemic inflammatory disease. Maybe they have an infection in their bloodstream, maybe they have an infection in a wound, maybe they have an infection in their line, maybe they're resistant to antibiotics. So yeah, and then some of these antibiotics are resistant. You got to wear gloves, you got to wear a gown, you got to wear a mask, depending on the patient. So we see this in the ICU in general, as well as, for example, you have patients who are, for example, C. diff. You're exposed to that. You're cleaning patients, you're hands-on with patients. So, you got to remind yourself that you are an anesthesia provider, you're a nurse, you are in the healthcare field for a reason. As long as you're practicing safe techniques, constantly hand washing, hand sanitizing, making sure you're meticulous with what you're touching, as well as keeping your hands clean. And depending on the virus or the bacteria, you're wearing, standard precautions that's required, as well as universal precautions. You're wearing masks, you're wearing an N95, or depending, you're wearing a certain gown, or you're wearing goggles. So no matter the virus, you just got to protect yourself and be safe, and I know it's a rough time because there are some facilities that they don't have access to, even gloves or even masks. You think these things are so simple, like why don't we have that? But you gotta think about the overwhelming patient population that's having these effects with the virus, which I feel for the families and the children and the parents and everyone, So in your mindset, yes, hours may be cut in half, but then that might be in the operating room. So then now they're trying to, with what's going on, depending on the ever changing, you might take your extra hours that you're working. Maybe you're working in the ICU, working in a regular OR. Now you may start having more of your hours in the ICU, doing vent changes. Maybe you're, assisting with critical care management. Maybe you're doing the intubations, you're doing extubations, you're doing weaning protocols. You are the one placing central lines. You're placing arterial lines. You're helping with management of patients in the ICU, which is great. It makes me feel like there's a lot of learning and growing, and I feel that this is a thing that will be changing with practice, and I feel we have to go with the flow and try our best to do what we can every hospital is different. Every hospital protocol is different. You have to remind yourself that, you're here to help. Yes, so people are affected with the hours. I mean, I know travelers or independent contractors are affected more because, we don't need as many people. But now if you're a full-time independent contractor, it might be a little bit different. For me, for example, I am an independent contractor. However, I'm a full-time employee at my facility. So therefore, my hours are cut in half, but that's temporary, and we just got to go with the flow. And I always believe that no matter the situation, you always have to prepare yourself. So I always believe that even though you're making a certain salary, you have to budget, you have to save. You always got to save for emergencies. You got to save because you never know what can happen, especially being a CRNA. Saying, for example, you're going on maternity leave, for example, you got to prepare yourself for that 3 months if you're doing. Especially one of my friends is actually on maternity leave, and she's an independent contractor. So you got to think about it. At 3 months, how do you prepare yourself for that? As well as, of course, a crisis that's going on right now. Maybe you're not having the amount of hours, so you make sure you plan for those type of things. So if anything ever happens, you have a backup plan. As well as, I think for me, on a positive note, I'm so excited to be home with my family, be home with my children, and be safe. As well as when I go to work, I put in my all and try to be the best that I can be. But you just got to have that positive mindset, and I think things will hopefully it'll naturally get better, and we'll see a lot of changes in medicine as well as changing in anesthesia practice, and I can't wait to see what's going to happen. So I'm definitely going to keep you updated on that. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thanks for watching.